So this is the half of the pelvis. You can see there the position again of the discus, and you can see that we have the nucleus pulposus and then the fibrotic annulus, which is here. You can see that we have here the capsule of the hip joint. So every white method there, it's some insertion of the muscles by the connective tissue, by the aponeurosis and so on. So you can see that here it's the attachment of the oblique muscles, abdominal. For example, here it's the rest of the superior pubic ligament above the symphysis. This is the symphysial part. And now when we speak about the hip joint, so you can see that the linea intertrochanterica is the border for the capsule, and on the dorsal side we have the crista intertrochanterica, and that's free. The border of the articular capsule, it's a little bit on the neck, because you know that the trochanter major et minor, it's attachment of the muscles, so the rotators and so on. So, and iliopsoas. So this is the differences, and now back to the ligaments. So we have here the ligamentum iliofemorale. So this is this part. So that means it's the strongest ligament in our body, because we are the postura is vertical. Then we have here some fibers which are ischiofemoral, pubofemoral, and they make the circular layer of the connective tissue, these ligaments around the neck. Yes, so you can see there it's the mixing of them. When we open the hip joint, so you can see very well nice femoral head, and inside the head we have the fossa, where is insertion of the ligamentum capitis femoris, and who asking, everyone who would to see. So this is the ligamentum capitis femoris. Yes, below it's a fat pad, so that's mean for the pressure of the head of the femur. Yes. So this strong is the capitis femoris. It's not like apicis dentis, only some small ligament. This is very large, strong ligament. During the operation, it's difficult to cut it and articulate the joint. The next you can see there, it's the nice articular surface for the femur in the acetabulum, and you know that we have here the acetabular notch, and the notch is crossing by the transverse ligament. So that's there. So it's really circled, it's not with the transversal. Normally, you know that we have here the ligamentum or the membrane of the obturatory, yes, for the obturatory muscles, and here it's the position of the sacrotuberal and sacrospinal ligament. Yes. So on the legs with the muscles, we open the maximus, gluteus maximus, then the medius, and then we see the part of the piriform muscle. And when you imagine that the pudendal nerve go out from these piriform foramen, and then again go to the pelvis by the foramen ischiadicum minus. So the pudendal canal, this Alcock's canal, for the innervation of the perineum is there. So it's a little bit strange direction of the one nerve. Yes, so from the dorsal side up the pudendal nerve, then around the spine, back to the pelvis, and then to the inferior part of the internal obturator muscle. You can see there the part of the deep muscles of the back, and the capsule of the SE joint, so sacroiliacal joint is there. So you can see the capsule, which is very strong and protect this joint. The last, what we can see there, is the position of the coccygeus, and this is the movement to the dorsal side during the delivery, or you make some treatment, and this is useful for everyone. I show you only quickly a knee. So you can see that the knee is connected in the three bones: femur, tibia, and patella. That's three. This is the patella. Patella is inside, it's included in the tendon of the quadriceps femoris, ligamentum patellae. Between the surfaces for the joints, we can see there the menisci. So the meniscus medialis and meniscus lateralis. It's this part of the cartilages. When we make the transversal section, you can see that it has the triangular shape. So on the side it's more higher, and in the center it's more flat. Yes. Do you have it? Mm-hmm. So meniscus, and by the cutting it's triangular.
Meniscus.
This one. And this one.
Okay.
So this is the border of the meniscus, and when we cut it, it's like the triangle.
Okay.
So this is the meniscus. And cutting. What else? So these menisci make deeper the part of the socket. So it's like a ball and socket. So the fossa is more deeper, and you know that in the knee we would like to have the two ligaments which limit the rotation. So this is the ligamentum cruciatum anterius, this one. And it goes from the anterior side. Yeah, this one.
Okay. Anterior? Okay.
Anterior.
Ma sul coniero mediale?
Sì, perché
And posterior in some other preparation is the same. When we close it, so you can see that we have the capsule, big capsule, Usually we speak about the ligamentum patellae, and then it has two flat parts in the side, and then specific ligaments are the collateral, which is in the lateral side, and in the medial, this one. From the dorsal side, we describe usually the obliquum and arcuatum. So this is two ligaments which are in the dorsal side of the capsule. Yes. Here it was the mistakes. We would like to make the sagittal section of the joint, and we make a cutting there, but it's a material there, so it was funny. But this is the very old system of the prosthesis. Yes, usually now it's from the titan or some other material, plastic and so on. So ceramic. Ceramic. Here you can see the ligamentum cruciatum posterius. Yes, posterius ligament.
The accessory ligament for the posterior.
Sometimes there are, we can find it, but usually it's more of use with the posterior one. Collateral ligament, this one, so that's one, it's the lateral and medial. They are flat. You can see there the interosseal membrane. Yes, so this is the interosseal membrane there.
Chi è che la voleva vedere prima?
Io, ma l'ho visto.
And here, tibia and the medial malleolus, fibula, lateral malleolus, together make the syndesmosis to be flexible between the position dorsal and the ventral, and ventrally it starts to dilatate. Yes, so it has the function. We should this joint protect by the side, because we need only flexion at extension, not rotation. So we have here the the tibial tibial, then the calcaneo, calcaneo-tibial ligament from the side, and dorsally talotibial again. Then we have the lateral collateral ligament, which is connected with the posterior processus of the talus, then the calcaneus again, and the talar anterior part. Yes, so now it's here not so much visible. It's a deep structure in the capsule, but these two you can see very well. Here we have the section of cuneiform, and the connection of the metatarsal bones, and you know that this is the place for the amputation. So sometimes when you have some problems with the inflammation of the fingers and so on, so sometimes for example during the winter and these situations, so it's a place where we can articulate the tarsal metatarsal bone. Yes.
Okay.
Let's